Welcome to News Bits from our Abuja studios in Nigeria. I am Grace Ukot.
And I am Shegun Babaranti.
In the news, NMCP holds 7th annual general meeting.
Acting President Goodluck Jonathan adds 5 more names to ministerial nominees.
Details in a moment.
Acting President Goodluck Jonathan has added 5 more names to ministerial list. They are Dora Akunjile, Shamsuddin Usman, Emmanuel Ehenacho, Musa Sada, and Professor Sheikh Abdullah. Yesterday, 23rd March 2010, the acting president sent the first list of nominees to the Senate, and the names will be screened on Thursday in the Committee of the Whole. Meanwhile, the acting president retained only 7 ministers from the old 42-man cabinet. A notable inclusion on the list is Alhaji Murtala Eradua, son of late General Shehu Musa Eradua, elder brother to President Umaru Musa Eradua.
The scourge of malaria in Nigeria is endemic, and it constitutes a major health problem. In view of this, the National Malaria Control Program, NMCP, was set up with the goal of lightening the burden of malaria by the year 2010. This is to be done with strategic interventions like advocacy, communication, and social mobilization. The NMCP, under the auspices of the Ministry of Health, hosted stakeholders to the 7th Annual States Program Managers Review meeting on the 23rd of March 2010 in Abuja. The Permanent Secretary of the Ministry of Health, Mr. Linus Awute, in his address, extolled the efforts of the NMCP and its partners in reducing the scourge of malaria. He emphasized the continued involvement of the ministry in ensuring that the target of 50% reduced mortality rate is achieved.
Malaria has brought a strain on the health system through overrated patronage, reduction in the productivity of manpower, who are not even spared the blows of the disease, and gross reduction in expendable funds, which could have been channeled to improve the functionality of these health facilities. One key intervention adopted by us to reduce the morbidity and mortality of malaria is improvement in case management through the provision of rapid diagnostic test kits for easy diagnosis in order to properly utilize the anti-malarial medicines.
He emphasized the continued involvement of the ministry in ensuring that the target of 50% reduced mortality rate is achieved. The National Coordinator, NMCP, Dr. Folake Ademola Majekudumi, in her presentation, gave a graphic representation of the initiative's activities spanning over the last 10 years. The presentation showed reduction in figures both in report and mortality of malaria cases, and she also spoke on the improvement of the statistics due to more media attention to the scourge.
We have the National Strategic Plan 2009 to 2013, which was developed by all of us to respond to the goals and vision. And we have important targets that by 2010, at least 80% of households would have had 2 or more insecticide-treated nets and long-lasting insecticide nets, and the level of coverage will be sustained up till 2013. That at least 80% of children under 5 and pregnant women will sleep under the insecticide-treated net, and that this coverage is sustained.
The highlight of the event was an exhibition showing the various states of the Federation where the program is active. The representatives of the states showed proof of their achievements in pictorial format and with other forms of documents as the Permanent Secretary and other guests went round the stands. They also mentioned improvements and challenges of NMCP in their various states.
The program in Nasarawa State, presently we are conducting training for health service providers that will be responsible for the distribution of ACTs and then distribution taking care of the needs. Second training too is ongoing for the private private health institution. That is, I'm talking of the PNVs and then the private clinics that will distribute the drugs, the ACTs, and also the NET.
It's been very good in Lagos State, the state government, in collaboration with the partners. They've done a lot of programs. In fact, we developed this 2010 malaria control operational plan. This one contains all the activities and programs we are going to carry out this year. And we've already done a lot of them. We've printed a lot of IEC materials. You can see them. There are so many. We've done training of role model caregivers in Alimosho local government. Over 120 role model mothers were trained. We also, in fact, we concluded the RRS in Ojo and Kurodu yesterday.
Honorable Oluwale Olakonde, Chairman, House Committee on AIDS, Tuberculosis, Malaria and Leprosy Control, and Professor Amobi Elika, Commissioner for Health, Anambra State, were in attendance at the event. Also present were various representatives of the World Health Organization, World Bank, and UNICEF.
What matters in any program is what we regard as evaluation and monitoring. This is a way of reviewing the activities of the different states program managers, and this is very important in whatever we are doing. We must be able to reassess ourselves and evaluate those things that had taken place.
Malaria has always been a public health issue in Nigeria, so the program has been as long as we existed and when the Ministry of Health started. But the concerted efforts of the Robot Malaria Partnership started in 2000 with the Abuja Declaration. You recall that I was trying to show a gauge, the malariometer, talking about the incidence rates and the case fatality rates. And the trend is that now we seem to be having more reported cases because there is better awareness created. But luckily, because of the interventions, the NET campaign, the drugs, treatment of pregnant women, the case fatality rate is on the downward trend.
And that's News Bits. Thanks for logging on.